Question 1. Identify all patient impairments, activity limitations, participation restrictions for the patient's primary health condition. Mr. Jenkins is a 74-year-old man who has severe osteoarthritis in the right hip and has had that for more than 5 years, and then just underwent posterior right total hip replacement. His following impairments are included as limited range of motion, muscle weakness, muscle guarding, pain. His functional limitations include inability to access transportation, pain with functional movements and activities. He has a history of prostate cancer, COPD. He is a smoker and has early dementia. Question 2. Review laboratory data and identify any values outside the normal range. Identify them. Which of the values are concerning and why? Mr. Jenkins, his prothrombin time or his INR is at a 1.2. Normal INR limits are zero point 0.9 to 1.1, but because Mr. Jenkins was previously on Coumadin, which is an anticoagulant, um, which he also previously stopped 4 days ago. His normal level should be greater than 2.5 to 3.0. So this gives him an increased risk of DVT or stroke. So we just want to make sure or check in with the nursing or also with the doctor just to see why he stopped taking his Coumadin and maybe just let him know that this is concerning. Question 3. Is there any additional information you need to clarify before initiating treatment with this patient? So, with Mr. Jenkins specifically, just how crucial and important it is to maintain all restrictions and protocols, especially with the patient's cognitive ability not being full 100%. It is even more important to keep reiterating the precautions and protocols to the patient, making sure he doesn't break the 90 degrees flexion with his hip flexion, and then also educating him on his osteoarthritis and any DVT prevention and why that's important to him and his health specifically. Question 4. What subjective information do you plan to gather from this patient and why? Identify at least two. So the first would be his current pain levels and how he's feeling with him being post-op. We just want to make sure he is not in too much pain and just check in with his nursing team. And then the second would be his cognitive state and also just making sure he's aware and also doesn't need any further assistance. Question 5. What objective data collection will be essential for this patient and why? Identify at least three. Consider daily note, documentation, and patient progression towards goals. So, with Mr. Jenkins, I believe gathering data on his bed mobility, his transferring, and then also balancing gait would be the most important data to collect, just because that is within the POC and that is what the PT is wanting to aim towards getting this patient independent and discharged. And it's also important for the patient because that gives him the freedom to do what he can do on his own. Question 6. What signs and symptoms, if observed, reported by the patient would cause you to hold treatment and check with nursing, the supervising PT, and or the physician? Identify at least two. The first would be cognitive state. With his early dementia and cognitive health not being 100%, it's necessary to take it day by day with the patient, being patient with him and being willing to keep trying throughout the day because some days are harder than others, and specifically when you're in a different setting, it can be disorienting to a patient. The second would be if lab values are not good enough. If his labs aren't at normal levels, then we just want to make sure we're checking in with his nursing team or the doctor to make sure he's physically capable and not put him at risk, and making sure there aren't any red flags stopping him from doing treatment.